This is a quick video to help you prepare for your central line dressing checkoff or evaluation. We always will start with a provider's order. So make sure you verify that you've got an order for your patient and have it telling what to do. So for this patient today, I see I have an order to change the PICC line site. We typically will do this about every 5 to 7 days, or if it needs it. So if the dressing's looking like it's coming off in between then. So I'm going to go ahead and start with all of our checkoffs. We always start with aided washing our hands. So obviously I don't have a real patient with me today, but just bear with me as we walk through it. So I've already verified my order. So before I come into the room, what I want to do is make sure that I have the supplies needed so that I'm not going in and out of the room. I've grabbed a central line dressing kit, which has chlorhexidine in it. So you'll want to make sure that your patient's not allergic to chlorhexidine. I've grabbed a biopatch, which is a little patch that'll go around the site that usually has chlorhexidine within it. Sometimes it has different properties to prevent infection, so use whatever your agency uses. I also will have gloves, clean gloves in the room, a surgical mask, and then if you don't like medium sterile gloves, which is what comes in the kit, go ahead and grab whatever size sterile gloves. I always have a second pair in my pocket just in case. So I've gathered all my supplies and I'm ready to go into the room to meet my patient. So I'll knock on the door. Hello, Miss Jones. It's Megan. I'm your nurse today, as you know, and I'm here to change your dressing on your arm. Just really quickly before I begin, can you please tell me your name and your date of birth? And I matched what she told me. So Miss Sally Jones, correct birthday, 225XX. And Miss Jones, I see that you don't have any allergies. Is that true? And she says no, she doesn't have any allergies. And then one last thing, are you experiencing any pain anywhere? And she said no. If she was, you'd probably stop and reassess that further. So a little bit of aided, I'm going to explain to her what I'm going to be doing. So Miss Jones, as you know, we have this PICC line that's in your arm and it has a dressing on it. And it looks like it's coming off a little bit. So we want to change it to ensure that you don't get an infection in that line. So to do that, I'm going to have myself and you both wearing a mask to keep everything clean. And it should only take about maybe 5 to 10 minutes tops. Any questions that you have for me about that? And she says no. And at this point, if there's any family members in the room, we would explain to them, but because it's a sterile dressing change, we'd ask them to leave the room for about 5-10 minutes, and that reduces the chance of anyone of an infection developing in the site. Okay, so now that I've already washed my hands, I've done it, I've assessed for pain. I'm going to get the patient in a comfortable position where I just have their extremity exposed. I always talk, make sure you watch your back. So I'm going to increase the bed to a good workable height so that I'm not hunched over. So once I've got just her arm exposed and the rest of her covered, I'm going to do a couple things to prevent the spread of infection. The first thing I'm going to do is have her don a surgical mask. We don't want her breathing on the site, so I'm actually going to ask her to wear this mask. Sure. And I'm going to help you with this, my dear. And it'll be just for a little bit while we're changing that dressing. It'll stay on there. Okay, so she's protected, and I'm also going to wear a surgical mask and gloves. And that's just to prevent me breathing, getting any of our respiratory flora on a sterile site. Hopefully you can still hear me with my mask on. And for this part, just clean gloves will do. Okay. The next step that we're going to do is take off the old dressing and we're going to look at it to make sure that there's no drainage, no redness, no swelling. So when you have a dressing like that, you never want to accidentally pull it out. Now some central lines or PICC lines will have a secure device like that, so it'll prevent it from pulling. Other ones will have these holes where they'll be sutured into the site. So you want to make sure that you don't accidentally yank and pull that at all. So what I'm going to do, I'll hold this up so you can kind of see it. We're going to remove the old device, starting from the top. Now if it gets stuck to the skin, you can go ahead and use an alcohol swab to kind of loosen it around, but we're going to just kind of gently pull from the top of the dressing, and we're going to pull it towards the site. You can kind of see it's fraying up here, so I'm going to get the end, taking very good care not to pull the site. So I'm going to hold from the top, so proximal to distal, making sure that I'm not pulling out that line in any way. Now again, it would either be secured by sutures or that cath secure device. And you can see why in here, as I pulled it a little bit, why that's imperative. Okay, so we've taken off the dirty. And now I'm gonna assess if there's any drainage on my old dressing. There's not, we can throw it away. And now I'm looking at the site itself, making sure there's no redness, no swelling, no streaking, and it looks wonderful. So at this point in time, what I'm gonna do next is take off my gloves, and I'm gonna perform hand hygiene before I start the sterile part. For the sake of this video, I'm probably gonna take this mask off just so that you can hear me better, but you would wear a mask for the duration of this procedure. Okay, so we've taken off the old dressing and we've assessed the exit site, okay? The next thing we're gonna do is take the central line site and we're assessing it. And what I'm looking for is that it has everything that I need, that it's not expired. If the patient was allergic to chlorhexidine, you would use a different type of solution to clean the patient's site. Depending on your facility, you might be using a biopatch, which is that dressing that looks like this. For my students this semester, we'll be using a 2x2, pretending that it's a biopatch. So once I've assessed that, I'm going to go ahead and open my sterile kit. So we never want to turn our back on our sterile field. So what I like to do is open it perpendicular to the patient so that I would never be turning my back on them. And what I'm going to do first is make sure that your surface is clean. So if it's not, you can take a wipe and clean it. And you're going to go ahead and open this just like any other sterile kit. And you always want to open it away from you so that I'm not crossing back over my field. Now some kits will have an extra mask in there. So for this procedure, I've already placed the mask on my patient and myself. So I can just take it and toss it. Okay, the next thing that I have in there is my sterile gloves. So I'm going to take that out of the kit and drop it. We'll put that on in a moment. And you'll see the next thing that's in the kit is the sterile drape. So what I'm going to do is take it by one corner and I'm going to kind of let it flop open. Of course, I have tape stuck to it. Okay, and we're going to let it just kind of flop open. And what we're going to do is once we get a corner, remember you can touch that 1-inch border. Typically we want to put the shiny side down. So you're going to take the corners and get it open. And of course this one isn't cooperating with me today. That's okay. So once we've got the two corners opened up, shiny side down, we're going to drop it here. And as long as you didn't touch anywhere in the center, you can touch that 1-inch border. Now I've got my sterile field established. Now look what happened, my kit closed. That's okay. What we're gonna do is reopen it again. Okay, and now I'm gonna take the contents of my kit and I'm gonna drop it in my sterile field. Being careful that I'm not touching anything and that it's not within the 1-inch border. Remember, we also brought in that biopatch. So now is the point where you're gonna open up the biopatch without touching it and go ahead and drop it into your sterile field, okay? Now this is garbage. Now we're at the point where we're able to don our sterile gloves. So I'm going to back this up just a little bit so you can watch me do that. You have your sterile gloves, hope you can see here. I'm still not turning my back on my sterile field. You're going to go ahead and open up your kit. Okay, and get underneath and open. Okay. I'm going to, of the first glove, touch the cuff. And I'm going to hold it up and away in front of my belly, okay? And I'm going to put my hand in there. Now, if I was really in the hospital doing this on a patient, obviously I'd have to remove bracelets, watch, all of that. I can touch that cuff, and that's it. And now I'm going to go under the cuff of the second glove and hold it up and away and make sure that I don't touch anything. And then we're sterile. So remember, when you have sterile hands, always hold it above your waist so that you don't touch anything. Okay, so now I'm ready to do the part where we're going to change the dressing. Okay, obviously you're not touching anything with sterile hands. I'm just doing this so you can see what I'm doing. Okay. Okay, so now I'm ready. I'm sterile, so I can touch anything within here. Within the kit, you're going to have a tegaderm. You have a chlorhexidine, which is what you're going to clean and wipe the site with. Okay. I put the bio patch in. You can see the bio patch has a split in it, and that you're going to actually put right over the right where it hits the skin so that they don't get an infection. You've got tweezers. You do have a Q-tip. I typically don't use that. If they had some drainage around the site, you could use that to clean. And that 2x2 is used for the same thing. So if they have any drainage, if it's someone who's really edematous, if they're diaphoretic, you may want to put this over the site so it absorbs the moisture. Okay. So the next part that we're going to do is clean the site. I'm sterile. So to activate your chlorhexidine, you're going to push this together. You'll hear a crack. And once it's cracked, hold it down. And what I want you to do, you wouldn't touch anything, you'd be sterile. You're going to start where it meets the skin. And you're going to vigorously, in circular-like motions, clean from inside to out. Okay? So we're going to start here, and we're going to clean all around, okay? Even the site, okay? And after you've cleaned it, we need you to clean for at least 30 seconds. We're gonna let it completely air dry, okay? So now I've cleaned it, we're gonna let that air dry. And after it's air dried, go ahead and you can pick up that bio patch and you're gonna place it over right where it meets the skin. So it should look something like that, okay? Once it's completely dry, then we're ready to place the dressing. So for the dressing, go ahead and lift it up. Now some of these dressings have an extra attachment piece that'll secure onto these two pigtails. This one does not. So the biggest thing is that you make sure that you're covering the site of insertion, center it right over the bio patch so it looks something like that. You do not want either of these clamps under your dressing, okay? Make sure that it's nice and fitted to the patient, that it's not going to come off on the next nurse. Typically, we only change these dressings every 5 to 7 days, so it is important that you get it on there and secured very nicely. Once you've got the Tegaderm secured, I'm going to go ahead and date, time, and initial. There's an extra little piece on here that peels off where you can place on there your name, your date, and your time so that the next nurse knows when you did that. I always put it off to the side so that you can be seen, but you have a clear view to assess the patient's site. Okay, and at this point, the sterile part is done. So at the end, I always ask that you clean up all of your stuff. So we'll get rid of all of this and go back to the patient. So I'll explain to the patient, we are all done. You did wonderful. We can go ahead and take off that mask now. Just to do, is there anything else that I can get for you? And I'll assess, do they have any pain? And she said, no, she's doing fine. So remember, I put the bed up at a good working height. So it's imperative that we put the bed back down, that it's locked, it's in its lowest position. Are you comfortable the way you're laying with the head of the bed? And she said, yes. So I will give her her call light. I've got the appropriate number of side rails up. She said she didn't have any other pain. And that's about it. So the last thing that I'm going to do is take off my gloves and perform hand hygiene, and then I'm going to document what I did. So I'll say about the old dressing, what it looked like, that it was clean, dry, and intact, that it was changed. Why? Was it a routine every 5 to 7 days, or did I change it because it was starting to come off and needing to be changed? I would document that I didn't see any drainage, any redness, any pain, any swelling. If you do notice any of that, it's really important that you call the provider right away. So I've already thrown away all my stuff, washed my hands, and then just continue documenting whatever that you did and for the next nurse to know when to change the next dressing. Good luck and reach out if you have any questions.